In 1980, the World Health Organization declared smallpox eradicated. That monumental victory relied on strict empirical observation and massive coordinated data collection in the field. But purely data-driven models have a critical blind spot. During the COVID-19 pandemic, sophisticated algorithms accurately projected clinic capacities, yet physical testing sites often sat empty. The math mapped the disease perfectly, but it completely missed the cultural realities, trust deficits, and access barriers on the ground. This reliance on numbers alone stems from a philosophy called positivism. It argues that the only valid truth is what we can measure, count, and objectively observe. Under this framework, researchers isolate variables and run closed experiments to find indisputable cures. Modern epidemiologists are hitting a wall with this approach. When we apply cold math to complex social problems, we strip away the lived human experience. A spreadsheet cannot accurately register decades of historical inequalities or economic austerity. To fix the future of public health, we have to look back at how we became so obsessed with objective data in the first place and understand why we are now forced to evolve past it. The shift toward raw data began in the 19th century. The Industrial Revolution packed workers into overcrowded factories, sparking severe cholera outbreaks. At the time, doctors blamed invisible poisonous vapors called miasmas. They were essentially guessing. A sociologist named Auguste Comte pushed back, arguing that society needed a science based entirely on verifiable facts. In 1854, physician John Snow took this empirical approach directly to the streets of London. This diagram shows his results. By plotting the locations of the deaths, Snow successfully correlated the mortality rates to a single water pump on Broad Street. Observable, measurable facts replaced speculation. Shortly after, scientists like Louis Pasteur developed germ theory. By proving the existence of microscopic pathogens in controlled laboratory settings, they locked in the verifiable, observable fact as the absolute gold standard for medicine. These early victories cemented a centuries-long belief: map the numbers, find the cause, and you conquer the disease. By the mid-20th century, the methodology expanded into what researchers call the web of causation. This framework treats diseases as aggregates of individual risk factors. To study health outcomes, epidemiologists isolate specific variables, like a person's diet or smoking habits. To prove those risks, the field embraced the randomized controlled trial. By dividing people into two carefully balanced groups, scientists create an artificial closed system. This allows them to cleanly test what happens when a single variable changes. The population-level gains from this evidence-based approach are undeniable. Large sample statistics and strict, falsifiable hypotheses provided the foundation to nearly eliminate polio worldwide. This exact same statistical rigor gave public health officials undeniable proof of harm, supplying the necessary evidence to combat powerful corporations and pass landmark tobacco control legislation. By the late 20th century, reducing human behavior into testable variables seemed invincible. The math worked beautifully, until the nature of the crises changed. In the 1980s and 90s, rising rates of chronic illnesses and the HIV/AIDS epidemic exposed the limits of isolated math. These health crises were deeply intertwined with politics, economics, and stigma. The critical flaw in strict positivism is methodological reductionism. Forcing massive societal issues like economic austerity or systemic racism into isolatable data variables strips away their history. You generate an elegant statistic, but you completely lose the context of how the suffering actually happens. This creates a dangerous, individualizing gaze. The data models blame illnesses entirely on personal bodies and behaviors, ignoring the political economy and neighborhood infrastructure that dictate those choices in the first place. Claiming these models are purely value-neutral often results in epistemic violence. Well-funded research institutions extract data from marginalized communities, run the numbers, and publish the results, frequently silencing the lived experience and community knowledge of the people they studied. The strict mathematical tools that successfully tracked a cholera water pump are blind to the structural inequalities driving modern disease. The solution isn't to throw away the math, but to stop pretending numbers are the absolute only truth. Modern researchers advocate for epistemological pluralism, a strategy that embraces multiple ways of knowing. Take eco-social theory and the concept of embodiment. This framework insists that human bodies literally absorb the story of their societal conditions. Years of discrimination or environmental stress become incorporated into our biology and create physical illness. To capture this complexity, the field is hybridizing its methods. Today, the most effective researchers combine the hard statistical rigor of randomized trials with deep ethnographic narratives and complex systems modeling. Looking back at this diagram of the web of causation, modern epidemiologists realize they can't just measure the threads. They have to interrogate the spider, the underlying political and economic forces that spun the web in the first place. True scientific maturity requires methodological humility. Elegant statistics are indispensable for describing the world, but to actually cure a population,